2017 marks the 5th anniversary of the EU, Luxembourg-WHO UHC Partnership. This partnership has the global ambition to promote policy dialogue on national health policies and strategies. So far, 28 countries participate in this partnership with the shared goal of achieving universal health coverage by 2030 as part of the United Nations Sustainable Development Goals. For this 5th anniversary, representatives of ministries of health, development experts, decision makers from participating countries, the EU, WHO, and donors all met in Brussels to celebrate achievements, to share experiences, reflect on challenges, and to discover exciting, innovative solutions.
For the first time in the history of the world, universal health coverage now is an official policy. And equity agenda has become an official program and a policy as part of Sustainable Development Goals. So in this context, this partnership is really working as a global catalyst to help countries move in this direction where everybody has decent health service and according to their needs. Without this consideration that you are rich or a poor, or you live in a rich country or a poor country, rural area or an urban area. So for me, this partnership is playing a very, very important role that it is helping us to catalyze that change which is taking place in any case, but it is helping us to accelerate that.
This partnership is impressive because 28 countries have the opportunity to develop activities to progress towards universal health coverage, each at its own path and each developing its own original solutions. That's fantastic.
J'ai l'impression que le dialogue sectoriel devient de plus en plus quelque chose qu'on comprend. Et j'ai vraiment cette impression qu'on commence à dialoguer, on commence à parler le même langage. Et je pense que aussi la dynamique est là. Au début, c'était très difficile. Au début, on ne voyait pas très bien où est-ce qu'on allait. Mais je pense que maintenant, quand on voit tous ces pays, on voit toutes ces délégations, tous ces gens impliqués, et je pense que les gens ont compris que le dialogue sectoriel est très important et que nous avons tous un rôle à jouer. Nous avons tous intérêt que ça marche. Et ça, c'est quelque chose que je pense que c'est positif.
I think the partnership is amazing, and I think the main reason is because it allows WHO to fulfill its mandate, its core mandate, to convene and broker policy dialogue.
If we take health development like a journey, and we take the health system like the vehicle, despite the considerable investment in the health system, that vehicle is not going anywhere just because it lacks the fuel. And I consider this project or this partnership as providing that fuel that makes it possible for the investment in the vehicle to make it actually perform its functions of driving health development.
What happened in this partnership that is for me very, very important and quite key, and I think also quite different from what we see in other projects or other interventions, is the fact that we succeeded in creating a strong relationship between the people at the country level, the Ministry of Health, the country office of WHO, of the World Health Organization, the partners, but also a strong relationship between the people working in the same kind of area in the different countries.
Je pense que l'intérêt du partenariat est lié d'abord à son objet. Il vise des domaines d'intervention qui sont d'actualité au niveau mondial et dans chaque pays.
Personally, I believe that the policy dialogues that this partnership has brought with very, I would say, really value for money, with investment monetary, however, with great investment professionally, morally, by all the stakeholders involved.
The most important thing in this partnership is its prime focus, which is universal health coverage, meaning that we want that people have access to their needed healthcare services and be financially protected. As a goal, this is really a noble goal, and countries have been appreciating the contribution of the partnership in helping them to moving towards that target.
With this UHC partnership, we have the opportunity, together with WHO, to come into much closer contact with countries and their governments to discuss how best to strengthen their health systems. The European Union supports anyway a number of countries, but this program widens the number of countries and the range of countries. And for us, we had in the beginning two goals. The one was to strengthen WHO vis-à-vis the governments and to give the ministries of health the opportunity to capitalize on our support on the way to universal health coverage.
It's a wonderful program, first of all. But in past 5 years, this program has achieved three things. One, it has really helped to have health system strengthening policy dialogue for universal health coverage, even when the countries are in the difficult situations. Second, it has strengthened a lot WHO country presence, but very close dialogue with the EU delegations and all development partners how to improve health. And the third, it has allowed in all the countries together, now more than 30 countries, to work very specific health topics, be it health financing, maternal and child health, aid effectiveness, quality of care, safety in hospitals. So it has helped us to bring together all those elements in past 5 years and now share between the countries.
Most countries in my region are middle-income countries, which they can and they should mobilize their own resources, but sometimes they need to share experience on how to mobilize the resources for health. They need also experience on how to better purchase services for their people. So learning from each other and using WHO or asking WHO to provide this intelligence, it's very much in demand.
Pour le Maroc, nous sommes en train d'engager un certain nombre de réformes où nous avons besoin d'échanges d'expériences avec un ensemble de pays et dans l'encadrement et orientation d'organisations internationales. Et le partenariat fait ça. Deuxième intérêt du partenariat, s'il vient à un moment où les objectifs de développement durable viennent d'être annoncés, il vise deux objectifs essentiels parmi les objectifs de développement durable, à savoir la couverture sanitaire universelle et le renforcement des systèmes de santé. Or, il n'y a pas de recette en matière de renforcement des systèmes de santé, donc les pays ont besoin les uns des autres. Ils ont besoin aussi de documenter leurs expériences et tirer profit des succès et des moins succès des autres pays.
I have seen this partnership being very effective and grow over the period of 4 years since 2013, where there has been an inclusive policy dialogue, making sure that all partners, stakeholders are engaged in the development of various strategies and plans, which has been the priority of Ministry of Health over the last 5 years.
I have a feeling that government representatives and donators, they pay attention to the civil society and they realize that it is maybe the best way to change cultures and mind and to bring the governments to go to the right way.
For me personally, the ambition in the next 5 years is to have tangible results when we move towards universal health coverage. Practically, it would mean that people pay less directly for medicines when they go to see healthcare, or we see better intersectorial dialogue, which means that our children can grow in the tobacco-free environment, or we have less car accidents. So that we have something tangible which is on the pathway towards universal health coverage.
The ambition is to extend the partnership to additional countries, to leave no one behind, and to support the countries to progress towards universal health coverage.
We can also provide a technical expertise that really help the countries in or building their health systems or transforming it in such a way that is more equitable, more participatory, that it corresponds better to the population. And the partnership does this in a flexible and comprehensive way in the countries where it is possible.
If we really think that we have this power to convey dialogue between people who not necessarily would work together initially, or we are in a conflictual relationship, I think what the partnership should do is certainly move a bit out of the boundaries of usual WHO action, which is very much focused on the Ministry of Health, and open the discussions between this ministry and some other ministries first, like the Ministry of Social Affairs or the Ministry of Finance.
We are expecting ministries of health to lead, but they do not have the right people with the right skills and the right competences. And so in Afro, one of the areas we are looking at is building the technical competence of Ministry of Health staff.
Je pense que le prochain, s'il y a prochaines 5 années, c'est de voir tous ces processus aboutir et avec des résultats concrets. Pas en termes seulement d'élaboration des documents, de dialogue et tout, mais sur le système de santé et sur la santé des populations. Quels seraient les indicateurs sur lesquels nous voulons peut-être agir pour qu'on puisse dire à la fin des 5 prochaines années, voici les indicateurs qui ont évolué, qui ont changé en termes de réduction de mortalité, de morbidité des populations, particulièrement les populations les plus vulnérables.
We, from our group, we found one ambitious objective in the future, that where we can make a kind of the training center or e-learning hub for the own countries. They can freely access, and we can share the experience as well as lessons, and then we apply in our own countries. And moreover, we want to have the inter-country agreement on what we do, and especially the neighboring countries. We should avoid any other conflict and join together to improve the UHC Universal Health Coverage.
Je pense par rapport à l'avenir que l'environnement mondial et les problèmes de santé et les transitions que connaît le monde se succèdent de plus en plus et changent de plus en plus. Donc nous sommes dans un contexte changeant et les pays n'ont même pas le temps de documenter leurs progrès et de documenter leurs politiques. Donc lorsqu'on n'a pas le temps, on va chercher le recul ailleurs. Et le recul, c'est d'abord les organisations internationales et c'est les autres pays. Et donc le partenariat vient justement à ce titre offrir cette opportunité, et il a l'avantage d'associer des pays en développement qui auront besoin sur une longue période de cet accompagnement pour réussir leur réforme.
In the next 5 years, I truly see a lot of potential for the partnership. First of all, we need to look at expansion. We need to get new donors on board and secure additional funding for the partnership so that we can implement it in more countries. The demand is there, the results are there, so it's time that we really go global with UHC. Linked to that is also the need for better and stronger communication. We see the successes and results of this partnership every day, but we need to communicate them to the outside world. They need to see also what we are achieving on the ground with this partnership. Universal health coverage truly covers the entire health sector and works towards strengthening health systems. As such, it may help us to move away from the silo mentality and the vertical ways of working that are still too common in the health sector today. We have always encouraged WHO to work closely with other partners in the health sector, be they other UN agencies, funds, or any others. Finally, and I think most importantly, we need to ensure that everything we do in this partnership is sustainable and that there is full national ownership. The end game really needs to be that ministries of health, national and local authorities fully absorb this and carry it forward.
In taking forward the partnership, I think what is really important is that we sort of capitalize on the knowledge that in the past 5 years has been building up, and that we make sure that we are in an exchange mode. Potentially we are already doing that. We have to sort of consolidate that and make it stronger, so that the knowledge management within the partnership is really the most important aspect of how these countries collaborate, and to do it more also in a horizontal way, I would say, among countries, when 2 or 3 countries can come together and share their knowledge and share their expertise, and more practically take the agenda of the universal health coverage forward?
I think we should aim high. I think we should be covering all member states of WHO in the future at some point. I think this is relevant not only for countries like Timor-Leste, Mozambique, Sudan. I think it's also just as relevant for countries such as Belgium or Switzerland or the US, for example. I think it is something that we should really aim for the 190-something member states that we have and keep moving in the direction of adding on more countries, getting more funding, and plod on till we reach the final goal of all member states of WHO.
I hope also that this partnership broadens, brings in more countries, more energy, and that we can actually show results. Because this is what we need to have in the era of sustainable development goals, is that we actually can show results, move towards new level, and leave no one behind.